I'm Sierra Fisher, and this is my first informative speech. I'm going to be talking about lung cancer. According to Bernard W. Stewart and Paul Kleehaus, lung cancer was a rare disease until the 20th century. Since lung cancer is the most common malignant disease worldwide and has increased rapidly, there are an estimate of 902,000 new cases each year. I'm going to discuss different possible causes of lung cancer, symptoms of lung cancer, and treatments for lung cancer. First, we are going to discuss different causes of lung cancer. According to Terry B. Peter, lung cancer is the most common cause of death in both men and women in the United States. This kind of cancer is difficult to treat and has already spread before being detected, making death rate so high for lung cancer. Stated by Peter, smoking causes an estimate of 87 to 90% of lung cancer cases. The body changes cigarette smoke into a potent called carcinogen. Even inhaling smoke can cause lung cancer. Other causes are toxic substances like radon and asbestos. Radon is the leading cause of lung cancer in non-smokers. Another contribution is air pollution, like smoker stack emission and traffic fumes. Next, we are going to talk about symptoms of lung cancer. Symptoms that were the most common and severe were pain, trouble breathing, and anorexia, according to the article Symptoms of Lung Cancer by Kretsch, Davis, Walsh, and Curtis. The results were the same in both male and female. When the growth and spread of lung cancer happens, other symptoms of coughing up red phlegm and wheezing occurs, according to Terry B. Peter. Quoted by Peter, sometimes an infection in the lung behind the tumor that is obstructing the airway produces a fever. Pain comes from the invasion of cancerous cells that push into the pleura, causing pain in the shoulders, chest, and arms. Enlarged lymph nodes happens when the surrounding tissue has cancer. This results in hoarseness. These are some of the symptoms of lung cancer. Lung cancer often moves to different parts of the body quickly. Finally, I'm going to talk to you about treatments for lung cancer. According to D.G. Pfister, one type of treatment is chemotherapy with definitive thoracic radiation. Patients with stage 5 non-small cell lung cancer, also called NSCLC, does chemotherapy. Stage 3 patients with NSCLC undergo chemotherapy and radiotherapy. It prolongs survival, unlike radiation alone. This treatment has good performance statuses. Another treatment is second-line chemotherapy. This does not confirm or refute that this treatment improves survival. Patients may do this kind of treatment if they are a good performance status of whom an investigational protocol is not available or desired, or if the patient responds well to chemotherapy and then experiences long, profession-free interval off treatment. Small cell lung cancer, also called SCLC, is more aggressive than non-small cell lung cancer. Quoted by David M. Jackman and Bruce E. Johnson, limited stage disease should be treated with etoposide and cisplatin and concurrent early chest radiation. Treatment with prophylactic cranial radiation should be considered for patients who complete remission. Stated by David and Bruce, extensive stage disease should be managed by a combination of chemotherapy with a regimen such as etoposide or cisplatin administered for 4 to 6 cycles. I have just discussed possible causes of lung cancer, symptoms of lung cancer, and treatment for lung cancer. Many people have lung cancer all around us. Let's try to minimize lung cancer now that we know some causes and symptoms. Also, we can try to keep an eye out for lung cancer and try to detect it early enough to stop. According to the Mayo Clinic staff, common tests to diagnose lung cancer are special view chest x-rays, lung biopsy, sputum cytology, CT scans, and positron emission tomography, commonly called PET scan.